Hello everyone, and welcome to this presentation on ethics and social science projects. This is a MENASP Social Policy and Conflict Prevention Programme presentation. The programme is funded by the AHRC GCRF Network Plus scheme. My name is Professor Rachel Forrester-Jones, and I'm one of the co-investigators of the MENASP network and this programme. And the aim of this presentation is to really give those of you who are thinking about applying for funding for research projects or knowledge exchange activities from this programme of commissioned research, just to give you a sense of what might be expected of you in terms of ethics. So it's an introduction really to ethics, but in particular, it's to help you in your endeavour of applying for this funding. So the plan of the presentation then is to firstly introduce you to universal research ethical principles, to talk a little bit about research integrity, think about research concepts, look at ethical codes and legal requirements, and review procedures. And then we finish the presentation with some practical kind of case studies where I'm going to be in conversation with experts in the field, researchers who have many years' experience in the field. And it's a chance really to hear about their individual experience of ethical issues in specific countries. And hopefully that will help you in terms of what it's like to think about ethics in practice. There will be two key questions on that application form, and these relate to two ethics questions, okay? The first one is, what are the likely key ethical issues you will face, and broadly, how will they be managed? The second one is, what ethics and governance approvals will be required, and what is your timetable to obtain them? So those are the two questions that you'll be expected to answer when you come to apply for funding. I'm now going to talk about research ethical principles, and these come from bioethics, biomedical ethics, and you can see this from Beauchamp and Childress, and if you want to read that book, there is the reference. But these are really adopted global ethical principles, and these are ones that we would follow in the MENASP network, and indeed that most social scientists would follow today. So these are non-maleficence, or minimising harm; beneficence, maximising benefit; autonomy, respecting the decision-making capacities of autonomous persons, enabling individuals to make reasoned, informed choices; and justice, distributing benefits, risks and costs fairly. So let's go into these in a little bit more detail so that we can see what exactly they are. So firstly, non-maleficence then. This really relates to not doing harm to research participants or minimising the harm that our research will do to them. And that's not only physical harm. In this social science application for funding, we will not be expecting you to actually be doing medical treatments or interventions on humans, and so we anticipate that there won't be any physical harm. But it also relates to emotional or psychological harm, in particular doing research on people that have been already traumatized or already abused. What is the likelihood of further psychological harm because of the research that we're doing, and how do we minimize that, risking people getting upset? And also reputational damage to those individuals. It might be to policymakers or decision makers. How do we make sure that we don't do harm in the process of doing our research, collecting data? It also refers to researcher safety. Not doing harm to ourselves or the people that are working for us, the research assistants. It relates to issues around safeguarding, around lone working, around emotional distress that the researcher might go through in terms of secondary trauma, that what they're seeing, what they're observing. So these are things that we need to consider in terms of non-maleficence. In relation to non-maleficence, it also privacy and confidentiality are two different things actually, but they go together. So privacy really respects privacy of an individual when collecting data, and this really relates to private issues that a person might have that you don't really want to interrogate them on for fear of embarrassing them, or for fear of just exposing things that are very private to them that are actually not related to your research. It may also mean that you conduct your research in a private location where no one else can hear them. And this relates to issues around confidentiality, safeguarding and communicating their data. So personal data, and this relates to a living individual from the data and other information that you're likely to come into possession of that could expose the person. So for example, their date of birth, you wouldn't normally want to collect somebody's date of birth. You might want their age, but you wouldn't necessarily need their date of birth. That would be regarded as personal data, and it's not something that you would necessarily need for your research. Other sensitive personal data might relate to their race or ethnic origin, their political opinions, their religious beliefs, trade union membership, their physical or their mental health, or their sexual life, or criminal offences or court proceedings. Now, if this is sensitive personal data that your research is not directly related to, then you don't necessarily need to collect that data, and that might be personal and private to that person. And so you must make sure that we observe their privacy and safeguard confidentiality, so that we don't tell other people about what they've told us when we're interviewing them. And there's a really good example of this in practice in terms of confidentiality and also anonymity. And this relates to a book that was written by R. Scarce called No Trial But Tribulations When Courts and Ethnography Conflict. Scarce was researching animal rights activists and was called to court to identify his respondents because the activists were involved in criminal activity, and this went to court, and so he was actually subpoenaed and called to court to identify his respondents. And he actually spent 159 days in jail because he refused to break their confidentiality. Now, would you consider that situation? Would you go that far as to spend days in jail because you don't want to break somebody's confidentiality? I mean, these are things that you may have to grapple with. This is where legal and ethical issues actually collide. And so it may be that when you're thinking about the topic of your research, you have to think through the ifs and or buts of what might happen in relation to the research and the data that you're collecting. There are limits to confidentiality, of course, that we would be upfront about right from the start, and that might be child abuse, including neglect, and information about terrorist acts. And again, you will have to think very carefully about limiting confidentiality and talk that through with somebody before you decide to research these particular topic areas, because there may be limits to confidentiality that you have to be really upfront of right from the start. So, for example, if there was an occasion where you were observing or somebody was telling you about child abuse, indeed, if you were interviewing a child and they were telling you that they were being abused, then in a sense, it would be ethically unethical not to actually talk to them about that and talk to somebody else about that and to report it. Another nice case study to sort of think about as an example in terms of confidential and anonymity is this study by Fitzgerald and Hamilton, published in 1996, and they were researching drug users in Australia and wrote a paper called The Consequences of Knowing Ethical and Legal Liabilities in Illicit Drug Research. Now, they were collecting data on illegal drug use, but again, the project eventually had to be cancelled because confidentiality could not be guaranteed. And so, they decided, unlike the previous study, they couldn't guarantee confidentiality, and they weren't prepared to go through with the particular research project. And you can read more about that. It's a fascinating read. But they actually got a paper out of this. They wrote a paper about it, and so all was not lost. But it's an interesting kind of case study, and if you're interested in that, I suggest you have a read of that one. Okay, again, in relation to autonomy, the ethical principles of autonomy. So this really relates to somebody's ability to decide whether or not they participate in the research or not, and they should be given that autonomy to decide. Now, how can they decide? Only really if they have informed knowledge of the research and if they are able to consent. And we call this informed consent. And in the UK, this comes under a legal document called the UK Mental Capacity Act. It's 2005, and there's a lot of information in there about how to gain informed consent. Now, other countries will have other laws and legal requirements for informed consent. Some countries may not, but in terms of ethics, even if there is no legal stipulation for gaining informed consent, ethically, we would want participants to have autonomy around whether or not they participate in our research or not. So when we talk about informed consent, that means that the potential participant is given information about all aspects of the research process. In other words, we disclose what the research is about, the nature of the research, the risks of any research, the benefits of the research to the participant. And very importantly, it just doesn't end there, that we give appropriate and accessible information, and that the participant understands that information. And they can only understand it if it is given in a way that is appropriate to their level of understanding. And so we may have to do a lot of work around translation, around using communication styles that the person will use themselves. It might be for the deaf community, using augmentative and alternative communication styles for people with intellectual disabilities, and so on and so forth. And the second part of informed consent is, of course, that the person is competent to make a rational and a mature judgment about whether they want to participate in the research. So we're not journalists. We don't go out there and just sort of walk in and start filming about a particular issue. We're researchers, and therefore we are bound by ethical principles of research, as well as legal principles too. So now in the UK, under the Mental Capacity Act of 2005, everybody is deemed to be competent to provide consent unless they are proven not to. But this may be different in other countries, and of course you will have to think about what are the legal requirements in your country of origin or your country where you're going to be doing the research in relation to this particular issue of consent. Very important again for consent is that the agreement to participate should be voluntary and free from coercion and undue influence. And we're not in the habit of making people participate if they don't want to. And people, of course, can choose not to participate. And in our presentations later with our research experts in the field, you'll hear some of the issues around this being talked about, and hopefully that will really help solidify this point. Now, consent for children is a particular subsection of this whole area of informed consent. And there is some really good information, good guidance on the UNICEF ethical research involving children guidance documents. So you can have a look at that, as well as Article 1 of the UN Convention of the Rights of the Child. It may well be that a child below the age of 18 actually has the maturity to understand, and the intellect to understand that the nature of the research, and that they do want to actually participate. Now, in the UK, the case of children under 16 years old who do not understand what is proposed, then their parents and guardians consent for them. If the parents or the carers are consenting on behalf of the child, though, it is good practice to try and explain and ensure the child is happy to participate. And this is what we call assent. But, you know, you have to be aware of gatekeeper sensibilities. So in this country, very often research in schools means that the gatekeepers are the head teachers in those schools, or the teachers in the classroom. And you would, as researcher, you would need to go through the school. And if the school says that they want the parents to consent for the children in their school to participate in an intervention, for example, an educational intervention, then of course you would need to go through that. And you would just have to explain that when you're going through ethical review. So this is really for children below the age of 16 years old who do not understand, who are unable to understand. But of course, as I said, children under the age of 16 years old can be legally competent to decide for themselves if they have sufficient understanding and intelligence to enable them to understand fully what is proposed. And this is the so-called Gillick competence, and this came out of a particular case in the UK, the Gillick versus West Norfolk and Wisbech Area Health Authority case. That this all went through the right up to the European Court of the European Court of Human Rights, and there are certain Fraser guidelines that can be gone through to enable us to see if a child under the age of 16 years is actually competent enough to decide for themselves if they want to participate in the research. But again, you know, there will be differences between countries, and that's all perfectly reasonable. We just have to justify and know what those legal requirements are in relation to children in different countries. And I've just been talking about the UK here. In terms of the UK case of children in other circumstances, there is this kind of transition period between, you know, still below the age of 18, where in this country you would be deemed as a child because you haven't reached adulthood at the age of 18. But children between the ages of 16 and 17-year-old, this is a kind of a transition period, and they are presumed in law to be competent. But at the same time, researchers are encouraged to involve their families in decisions, and individuals cannot refuse treatment, for example, agreed by the parent or the court if it's in their best interest, and that goes for social as well as medical interventions. Now, again, in the UK, if children are between the ages of 16 and 17 years old are in receipt of national health services or social care services, then the research will need to be submitted to the National UK Health Research Authority Research Ethics Committee for a favourable ethical opinion. We really refer to ethical review as the outcome as a favourable ethical opinion if it's a successful outcome, rather than approval, because no one can really approve your ethical research. It's really an ethical opinion. And of course, this really also notes and refers to the fact that once you have this favourable ethical opinion, that's not where it all stops. You don't just go into a place and say, I've got ethical approval and now I can do, you know, whatever I want because I've got the piece of paper. No, it's an ethical opinion about the research, and of course none of this is static. When you go out into the field, there'll be all kinds of ethical issues that will crop up. And this is really about preparing you for those. Again, in your own country or in different countries, there may well be other particular legal requirements for children between 16 and 17 years old. So you just need to find that out and be prepared and abide by those legal requirements. Again, in terms of competence to consent, it's not just about children. It might be about older people, people with dementia, people with learning disabilities or intellectual and developmental disabilities. So in terms of competence to consent, of course, we know that competence fluctuates, and so it must not be assumed. So somebody may be with a severe mental health, chronic mental health problem or dementia. Their competence, they may be very competent on a particular day, and they may be able to consent with the information that's been given to them. But when it comes to the actual interview that you're doing, for example, or focus group, they may actually not be able to consent. And therefore, you cannot assume just because they maybe even signed a consent form previously that they are now consenting. And so, again, we have to play it by ear in a sense and make sure that we're not interviewing somebody when they are actually in a period of the day when they're not actually consenting. Likewise, we must not assume that people are automatically without competence. And I've been in situations myself where I've gone into service situations where the owner of the private organisation, for example, that is caring for people with dementia has just said to me, look, they don't have competence, you won't get anything out of them, you won't get an interview, so, you know, just forget it. And then when I've actually gone in and tried, then, you know, I found that they're perfectly competent and they really enjoyed the interview. And so therefore, you know, I had to negotiate that with the person that was in charge and just softly go in there and just find out you know, actually found out that, you know, those people were competent. And again, as I've been saying, the information must be accessible, it must be relevant, it must be understandable. Otherwise, people are not going to be able to consent properly. And just again to reiterate that consent is not static, it's very fluid, and you need ongoing consent, especially if the research moves towards a different direction. And that may happen with your study, that, you know, you go out with a particular topic, but in the end, something else crops up that is completely different but very important. Well, you would have to then re-ask for consent to the individuals. You may actually have to go back to ethical review if it's so different to what you started out with. Now we move to the research ethical principle of justice. And justice really refers to the distribution of benefits and burdens. And there's quite a lot to say about this in terms of, you know, who is really benefiting from our research? Is it us? Is it in terms of the PhD that we want to get? Is it in terms of the career, how we're moving on? And we have to be upfront about that. Is it actually going to benefit any of those individuals that we're researching? It may not, but it may benefit in the long run. You hope that it may benefit people, a whole population of people. It may be that your activity is an intervention. And we have to be very careful about who is actually going to benefit from that intervention. If it's a very beneficial intervention, is it that we're going to be excluding people that could benefit from it? And that seems unfair and unethical. So how do we get around that particular problem? Well, there are certain things that you can do. For example, a waitlist control group, where some people, the control group, benefit from the intervention to start off with. The control group then wait a little bit while you're doing the research, but then you give them the intervention as well at the end of it. Of course, there's also distribution of burdens, and coming with any research, there will be burdens on time, there may be burdens on cost, there may be burdens on reputation, there may be all kinds of burdens on those individuals. And again, we have to think about the pros and cons of the actual research that we're doing and how justifiable it is. we really don't want to be in the habit of exploiting people, and this would be unfairly taking advantage of research participants just to get our data and not really sort of thinking about them, or imposing unfair burdens of time on participants for the sake of benefits to ourselves, to just because of the research. And unfortunately, in the past, researchers have sullied the landscape for other researchers in terms of doing a kind of a quick and dirty study where they've just gone in and just grabbed data and not really thought about the impact of that on those participants. But again, in terms of distribution of benefits, discrimination, if we're unfairly excluding particular groups from participation in research and the benefits that they may attach to participation. Well, those are the 4 ethical principles. And now I just want to move a little way towards the kind of broader ethical principle of research integrity. And this really relates to the whole part of our study, from the start of when we're thinking about it, putting together the design of it, to the gathering of data, the analysis and the reporting of findings. And throughout all of this, we must be honest and transparent. It's not really about recording and reporting on particular findings just because they're the good findings, and failing to or omitting findings that are, you know, not really what maybe the funder might want to hear or that really work for us. So this really relates to rigor, the rigorousness that we have on collecting data, the rigor of analysis, the rigor of reporting our findings. And this is in line with disciplinary norms and practices, and the type of norms and practices that we would expect of a good researcher in all disciplines. And also in relation to care and respect for our participants and stewardship of their research, the data, and our scholarship. So it's about, you know, not plagiarizing. It's about being careful to when we're choosing authorship, which names are going on our papers. But it's also about the stewardship of the data and taking care of that data. There have been in the past horrific examples of people leaving data on trains, for example, where they haven't anonymized it. It is really about taking care of that and looking after that data. And this is about management of your data set as much as anything else. And now I want to move to 2 concepts really that sometimes people get a little bit mixed up about, and hopefully this will help clarify what those are. So the first one, of course, is research ethics, and that's the application of ethical principles or values to our research, and that's what I've just been talking about for the last 20 minutes or so. The second concept is research governance, and this is different to research ethics, and research governance actually relates to the more kind of bureaucratic form filling out, but this is ensuring research is conducted in accordance with appropriate ethical, legal and professional frameworks, obligations and standards. So that's really about, have you taken out the right measures? Have you taken out a risk assessment? Have you taken out, have you got a data management plan? Have you got participant information sheets? Have you got ways and means of getting informed consent? That might be signed formed consent form, or it might be just getting a video recording of consent or an audio recording of consent, or, you know, some other means that is appropriate for the actual sample that you are going to be researching. And that's really, so that's what research governance is about. So it's, if somebody was to audit and come back and ask you, you know, do you have that kind of paperwork and the evidence of that, that you've gone around about the research in the proper and the right manner? Now, we're not, you know, supposed to think about this just on our own. There are lots of ethical codes to help us. Now, these aren't legal codes, but they are ethical codes of guidance. And these really came out of the Nuremberg trials in 1947, and subsequent to that, that was due to the medical atrocities that were carried out on people who were in concentration camps. And the Nuremberg Code relates to research ethical principles for human experimentation, but most of the global ethical codes have come from that Nuremberg Code. There is the Declaration of Helsinki, the Belmont Report, and the list here is really international, and you can adopt and read some of these ethical principles and guidelines and adopt those for your particular project. There are also professional ethical codes, and it may be that you abide by anthropological codes, it may be their social science codes. I've just given an example here of the International Sociological Association Code of Ethics of 2001, but there are subsequent revisions. And this is guidance to help protect the welfare of groups and individuals with whom sociologists in particular work, or who are involved in sociologist research efforts. And you will find that these codes of ethics are very much, professional ethics are very much the same. Similar types of issues will be talked about and discussed in these codes of ethics for all humanities and social sciences professions. But that's just one example, but you may have your own. There are also, as I said earlier, there will also be legal requirements in each country, and you will have to abide by those, and you'll have to name those and think about those. I've just put on one. This is just one example of a legal requirement in the UK, the protection of personal data. And this is the EU General Data Protection Regulation that came into force in 2018, and that superseded the Data Protection Act that we had that in the UK. But it may well be that you have your own legal requirements in your country, or the country that you're going to be researching, and so you'll need to kind of look that up and think about that. Okay, so we've gone through ethical principles, we've gone through ethical codes. We're now looking at review procedures. And as I say, for the actual application form, there's just those two questions that you need to discuss and you need to answer. But once you are successful, then you would need to go through ethical review. Why do we need institutional research ethical review procedures? Well, they are essential, we would argue, for ensuring the dignity, the rights and the safety and the well-being of research participants. It's all about the research participants. It's also about research safety as well. It may well be, and increasingly so, that you have to actually provide evidence of ethical review, of successful ethical review for your paper to be published, your findings to be published. Many journals now, publication, require you to sign a declaration that you have gone through ethical review and that you have an ethical review reference code as evidence of that. And certainly most of the, in fact, I think all of the journals that I now publish with do actually require this. It may also be an institutional requirement, and certainly any research going through the University of Bath will have to go through ethical review. This is largely to do with not only because, you know, all institutions, universities want to ensure the research participants are looked after in that sense, but also because of reputational risk if things go wrong. We can't really have researchers going out and doing research when they haven't considered the ethics of what they're doing. Also, in terms of Retraction Watch, this is an international organisation that actually will call out papers that have not gone through ethical review, and they will seek to get those papers retracted, and none of us want to have that happen to us. There will also be funding requirements, and indeed requirements of this funding that we are commissioning. It is a requirement that you go through at the requisite ethical review if you need to. And then there's other larger kind of more global requirements. So, for example, the European Research Council, the US government research funding policy and legislative requirements. And it's also about public trust as well in research and researchers. the public need to know that, you know, we do consider ethics, and we're not out there to harm anybody, or and we are there to really be the scribes of what is happening in the world, and hopefully putting in interventions and policies that improve the world and the lot of individuals in society. So when does research require ethical approval? Well, certainly if we are interviewing humans, if our research includes human participants, and this includes interviews and surveys, the involvement maybe of staff, students, family members, as well as direct involvement of other groups. But also in relation to human data, it may be that you have access to data that's in the public domain that is completely anonymized. And in that sense, you wouldn't necessarily need ethical review. But if you have access to personal or sensitive or confidential information of human data, then you will most likely need ethical review. It may be that you're looking at secondary analysis of anonymized data, but from which individuals may be identified, possibly because you're combining that anonymized data with other existing information that will enable you to identify particular individuals, and therefore you will actually need to go through ethical review. You will need ethical review if you do any research on human tissue or samples, but also some non-human subjects, for example, animals, and any research involving risk of potential harm to the environment, to other cultures or historical sites where you're actually, you're doing a practical research piece. Now, just a warning here also that those of you that are going to apply for the research funding, you will be the principal investigator. And you as a principal investigator are responsible for ethics, for ethical review, but also for ethics in the field. So it is a responsibility. You're responsible for the whole project as well as for the research assistants who are conducting themselves in the field as well. So what do reviewers look for then? Mainly, they'll be looking for, is there possible harm to participants, and how is that possible harm being mitigated against, the risk being reduced? Is there any invasion of privacy, and how is that justified, and how is that going to be reduced or mitigated against? Do respondents have enough information to make an informed choice, a decision about taking part in the research? Do people have the option not to participate? Is it completely voluntary? Can they opt out at any point, up to the point at where the research has been analysed anonymously? And is the research actually justifiable? Is there a balance? What's the balance of the risk and benefit? Is it just so too risky that there's not going to be any benefit to this research at all? What's the point of it? So these are the things that reviewers will actually look for when they're reviewing your project. Now, I've talked a lot and presented a lot about really the kind of the bare bones of ethics, but we're now going to look into some of these issues in a little bit more depth, and this is where we come to ethics in practice. And we've maintained a series of in conversation with researchers who talk about their experiences in particular countries, and we do hope that you will really get to grips and understand how ethical issues crop up when people are in the field, and also what their responses are. And, we do hope that this novel way of sort of giving you some insight into ethical issues will help you with your application for funding. So you're going to hear from Dr. Sarah Bailey, from Dr. Joe Devine, from Dr. Sophie Plagerson, and Dr. Ayat Nashwan, and there's a little bit there about each one of them, but I do hope that you've enjoyed this presentation, and I hope that it's been of use to you. Once you are successful, if you are successful in your request for funding, then there'll be more training. But this is really just to give you a flavour and to help you think about those two key questions that are on the application form. Thank you very much for listening.